how do we view autism today from homeopathic lens? Like, can we sort of understand it via Hahnemannian classification of these or diseases, or what Hahnemann has given, his classification or understanding about diseases? How do we see it through homeopathic lens?
Any disease can be still understood in terms of what Hahnemann has written. What Hahnemann has written in terms of mental health issues and psychiatric issues. Now, there is an ambiguity in terms of what whether we can call this disease or syndrome as a mental health issue per se. But considering that most of the areas where the deficit lies are on the mental front, we'll rather put it not in a corporeal disease. The more apt classification would be of mental diseases.
Right.
It's not a true psychiatric disease per se. It's definitely a neurodevelopmental issue, but the plane that is affected is related to mental health. So the classification that will fit in will be of mental health issues. And where does that classification exist in homeopathy? It's between aphorism number 210 and 200 number 30.
Correct.
And within those 21 aphorisms, what Hahnemann wrote was that psychiatric ailments are of two types. One which begin on a corporeal plane, and he believed that majority of psychiatric issues, mental health issues, begin on corporeal plane, and gradually the physical health issues become less and less and less, and the mental health issues become more dominant in such a way that it looks like a one-sided mental health disease. Whereas it is actually a corporeal disease which has settled more on the mental health plane. And the second issue where he has mentioned that it's other type of disease which are truly psychiatric in nature. So this is the basic classification, and I believe the first aspect is where autism lies, because autism is not just a disease of the mental plane. It is a disease which affects the person as a whole. I'll give you an example about that. There are so many children with autism who also have issues related to digestion and constipation. So you can see it's something that is very common. They have their own food sensitivities, reactions. So we know that this disease is not affecting the mental pain alone. It is affecting the whole person. The physical aspect is also affected, not just the mental aspect. The mental aspect dominates. So we actually, when we are speaking in homeopathic terms, the old classification works very well. That it is a disease which is corporeal in nature but affects the mental plane more. And what Hahnemann has written in aphorism number 217 is that whenever you come across such a disease, the treatment has to be based on the totality. And when we say totality, what we mean is that we have to take the mental symptoms as well as the physical symptoms in consideration, in togetherness, in totality. Only then we are able to find the right remedy. Then in aphorism number 224 and 226, Hahnemann writes about the role of counseling, psychotherapy. True. So even today we are using all these tools as part of psychiatry, as part of counseling, as part of different types of therapies. Even with children who are autistic, we are using these tools, counseling tools and therapy tools. What is this? This is what Hahnemann has written in aphorism number 224 and 226. The kind of therapies have changed, but the gist of the words of Hahnemann are still very pertinent, very pertinent. So what Hahnemann has written is that you take the totality of the physical and the mental symptoms to figure out what remedy a child would need. And then in aphorism number 221, he had written that whenever there are acute episodes in a psychiatric case, you need a different remedy. For example, a patient who is into say an anxiety depressive patient for some reason goes into peronia. Now in that acute state, you need an acute remedy. That is what Hahnemann has written. And
Yeah.
once the acute state is over, you go into again your chronic state. This is what we
Hmm.
see even in autistic children.
Okay.
Autistic children also at times go through a lot of acute stages.
Correct.
There are phases when they will become suddenly, some of them, not all of them, suddenly they will become very violent, very aggressive. And that stage might need a different remedy. So it's like, in general, also Hahnemann is not written that you need one remedy in classical homeopathy for life. In autistic children, I have seen that it's very often required that we need to change the remedy as the symptom picture changes, and the symptom picture changes very frequently.
True.
Very frequently. We are going stable with a remedy, and then the child hits an acute. For example, the
Yeah.
child gets a fever, and after that fever, you again see a regression in certain set of symptoms. And that's once the symptom picture changes, we again need to change the remedy for that child in that state. And we might come back to again the old remedy, but we might never come back to the old remedy.
Yeah. Right.
So, this is what Hahnemann has written, and I believe that largely the guidelines remain perfectly applicable even today. The principles do not need to be modified to suit autism.
Yeah.
The principles are largely okay. You do need to add your understanding of modern medicine, prognosis, diagnosis. You need to understand the general management of those cases. That I believe is very, very vital, very important. So
True.
that needs to be added, but that doesn't change how homeopathy works in these cases.